This presentation's intent is to explain that Ohio has two distinct epidemics that are now a public health crisis. The two epidemics are prescription opioids and illegal heroin. In the past decade, prescription opioid medications have killed more Ohio citizens than our heroin epidemic. I ask you for the next few minutes to separate both of these epidemics in order to rationalize what we can change.
I think it's really hard to understand addiction because it's with all psychological and mental illness, you only see the behavior, you only see what's on the outside, and I think that's what's really hard for people to understand, is that there's changes that are causing these behaviors that are happening like at the chemical level. It's not a lack of parenting, it's not willpower, it's not whether or not they were raised in a church. It's much bigger than that, and it's bigger than really science even knows up to this point, being that it's a brain disease. We have imaging that proves that the brain is malfunctioning in an addict, and there's two main parts of the brain that are significantly affected in an addict. The reward center. The reward center houses the survival mechanisms of the brain that naturally occur. And so when we do things that promote our survival, so we eat or drink, sleep, things like that, dopamine is released and they stimulate this area of the brain. Drugs act in a similar way in which they stimulate this same area, but to a greater degree and for a longer duration. It's estimated to be about 100 times the amount that our survival mechanisms would. And so an addict is essentially reprogramming their brain to now think of a drug as its number one thing necessary for survival. And so it makes sense that somebody's willing to give up, all of their basic daily needs in their family in order to get this rush of dopamine. And the second part of the brain that's really affected is the frontal lobe. The frontal lobe is responsible for all of our learned social behaviors and our ability to control our impulses. In brain imaging, this area of the brain is essentially inactive in an addict. And so it makes sense that when an addict is trying to determine what's right from wrong and is trying to suppress behaviors, if that area of the brain's inactive, they're not going to be able to do those things. And so with those two things in effect, it's just this never-ending cycle because the person doesn't have the brain capability or potential to handle these behaviors.
Genetic factors account for about half the likelihood that an individual will develop addiction. Addiction is not a choice disease.
Charles Taylor interviewed the White House's top drug policy official, Michael Botticelli. You can see the full interview in the February 22nd online edition of County News.
We know that about 4/5 of newer users to heroin started by misusing prescription pain medications. So, this is really an epidemic that has two dimensions to it, but really has its foundation in prescription drug misuse issues.
Now let's turn to something else in the news right now so much. When you think of the Surgeon General's office, maybe you think about warnings about smoking back in the early 60s that led to those warning labels we all know on tobacco, or maybe you think about the 1980s when C. Everett Koop wrote to the American people about the AIDS crisis. Well, now the current Surgeon General, Dr. Vivek Murthy, is trying to be a game changer for what he calls the public health crisis of this generation, the abuse of prescription painkillers and other opioids. He is taking the unprecedented step of writing a letter to every single prescriber in the U.S. about the dangers of over-prescribing for pain. It seems to be the very first time that the nation's top doctor has taken a cause directly to his or her medical peers, doctor to doctor. And Surgeon General Vivek Murthy joins me now. Nice to see you again.
Thanks so much, Kate. It's great to be with you.
Let's talk about what you're doing. We have an excerpt from the letter that you're going to be sending to every prescriber in the nation. It'll go out early next month. You write in part, we have the unique power to help end this epidemic. You're on a whirlwind tour. You're in Tennessee today. You're all over the country for the next several weeks. You're planning an editorial. You're really trying to get some attention for this. Why is this so important to you?
Well, this is one of the greatest public health crises of our time, the opioid epidemic. And it hasn't been done before that a Surgeon General has written a letter specifically to healthcare providers, asking them to be part of joining a movement to end a healthcare crisis. But I'm doing it because this crisis is that big, it's that important. And I'm here in Meharry Medical College talking to clinicians today, to doctors and nurses, to pharmacists, and to nurse practitioners. And we've been talking about steps that we can take to overcome this epidemic, including changing how clinicians prescribe, including training more clinicians to identify and provide treatment for addiction. And we've been talking about how to change the stigma around addiction so that more people can come forward and seek help.
We don't know yet what killed Prince, but we do know that he had opioid painkillers with him. Millions take them, many are addicted. How did we lose control of opioids, and how do we get the epidemic back in the bottle? Jim Axelrod spoke to one of America's most prominent doctors.
This has been one of the great mistakes of modern medicine.
Dr. David Kessler, who ran the FDA from 1990 to 1997, doesn't hold back when talking about the explosion in opioid use in the last 2 decades.
Who's to blame? FDA has responsibility, the pharmaceutical companies have responsibility, physicians have responsibility. We didn't see these drugs for what they truly are.
From 1999 to 2014, sales of opioids quadrupled in the U.S., and so did the number of opioid-related overdose deaths.
There was a notion that pain was the fifth vital sign, that you wanted to relieve pain, that was essential. You dosed until the pain was alleviated.
That, says Kessler, was a costly mistake. 78 people now die each day from overdosing on painkillers. But the CDC didn't issue prescription guidelines until this past March, recommending doctors try over-the-counter pain meds before prescribing more limited quantities of opioids, but not mandating they do so.
Given the fact that this country is in the middle of a crisis, are these guidelines strong enough?
We'll say, this is an American condition. This is an American disease.
In the 21 years since OxyContin first came on the market, it has generated more than $35 billion in sales.
The inappropriate promotion of drugs contributed significantly to this epidemic. But this...
How? Tell me how.
Because drug companies took a small piece, a sliver of science, and widely promoted it as not being addictive. That was false.
You just heard the former FDA head, David Kessler, state, "This is an American condition, an American disease." This slide from the United Nations Office on Drug and Crime shows that America is #1 in the world in the use of opioids. You also just heard David Kessler state, opioids are one of the greatest mistakes of modern medicine. Chart source, Center for Disease Control. The light blue graph illustrates deaths from prescription opioids. The dark blue graph illustrates deaths from heroin. The far left starts 1999, the far right ends 2014. Prescription opioid deaths were about 25% higher than heroin deaths in 2014. Opioid prescription deaths from 1999 to 2014 killed approximately 165,000 American citizens. This is more deaths than American deaths from the Vietnam War and Iraqi war combined, and the overprescribing of opiates goes unregulated and ignored. This graph comes from the University of Wisconsin and the World Health Organization. The illustration is a pharmaceutical opioid consumption. Left side represents global statistics, the right side USA statistics. The pink color is oxycodone, the most popular extended release opioid prescribed by physicians. The other color opioids are morphine, methadone, fentanyl, more typically dispensed in hospital settings. This is a clear example of an American condition and an American disease. Another comparison from the same source, illustrating on left USA, on right Europe, and using only the legal prescription opioid called oxycodone in the blue. A very stark contrast between two major regions of the world and another illustration of an American condition and American disease. This graph is from the DEA, showing the blue line a 300% increase in opioid prescription dispensing and sales from 2000 to 2012. The red line showing the same 300% increase of prescription opioid deaths over the same period. The more prescription opioids that are prescribed, the more prescription opioid deaths occur. While human pain has not increased, but the physicians' prescribing habits have. A 2015 visual message from the CDC. Nearly half of all opioid overdose deaths involve a prescription opioid. So from the past slides, it seems very clear that America is a leader in the world in opioid overprescribing and opioid deaths. We have heard this is one of the greatest mistakes of modern medicine. We have heard that 4 out of 5 current users of heroin started with prescription opioids. Now let's take a look into what states in America are the leaders in this problem. This is a SAMHSA illustrated chart showing in purple states with the highest opioid overprescribing habits. Ohio is a leader in this illustration. November 2016, Columbus Dispatch states, Ohio leads the nation in overdose deaths. In this article, it also states, highlighted in the blue outline note to the right, in all categories, Ohio easily surpasses states with larger populations. Statistics from the CDC Wonder data site. Comparing 3 states, opioid and heroin deaths, and each state's populations. Starting on the left, Ohio with 11 million population had 2,698 deaths. California with a 39 million population had 2,018 deaths. And Florida with a 20 million population had 1,838 deaths. California with close to a 300% more citizens had 25% less opioid deaths than Ohio. Ohio is a leader in the USA.
Dayton, Ohio, ground zero for heroin in the United States. You may not know it, but there were more overdoses here per capita than anywhere else in the country. Last year, 250, this year, around 400. So we decided to go with the Montgomery County Sheriff's Department and see how they are battling this serious epidemic. Sheriff, where does heroin rank as a criminal problem in your county?
It's the #1 problem in our county right now. We haven't seen anything this bad in a long time.
The CDC and the medical community acknowledges that the overprescribing of prescription opioids is an epidemic in 2012. That's 5 years ago. Did the medical community regulate and reform their prescribing habits since then? Let's take a look.
We had to adequately treat pain. Unfortunately, there was not a lot of evidence-based research at the time on how we were going to treat pain, but we had these great cancer drugs out there that were to make people's lives more comfortable in the life situations. So we decided we were going to start using those to treat chronic pain. What I tell you about the early 1900s, we had how many women addicted in the United States to opiates? If we go back throughout history, how many times have we seen other civilizations addicted to opiate-like products? So we're going to treat people over time, chronic, not acute, but chronic over time. We're going to treat them with opiates. What did we think was going to happen? I'm not a medical profession, but we didn't have a professional. But I do know if you use opiates long enough, you're going to get addicted. It's just the nature of what we know. History has told us. We didn't learn from history. Now there's a movement in the medical community that says, and I'm quoting a physician, a well-known physician in Central Ohio who treats pain. He got up at a conference and was addressing several pain management specialists and addressed them by simply saying, this 15-year experiment of treating pain using opiates has clearly been a failure. Now it's time to go back. And he said, now it's time for us to learn what these opiates do, the dangers of them, and use them in situations where they're appropriate, which may be in the use of treating long-term chronic pain, but we need research to back that up. And that's the movement. Education in the medical community has hit an all-time high on this issue. So hopefully what we see is much more responsible prescribing. And what I tell people, when we've looked at prescribers throughout Ohio, you can break it down into 3 groups. You have a percentage, which is probably 4 or 5%, who specialize in it. They do it right. They take care of their patients. They know when to treat them, when to prescribe opiates. Last resort, build them up to that. Nothing else will work. They start prescribing opiates. You have the bottom 2 to 3%, which are the ones that I get to deal with. And those are the ones that say, I've got a license to make money, and I don't care if I harm a patient or not. That's only about 2%, but they've done a lot of damage, and they've done a lot of damage here, Scioto County, all over the state. Those are the ones we prosecute, take their license, put them in prison. What is even scarier is that middle group, that other 90-some% that have the ability to prescribe, but may lack the education specifically to what opiates can do. And unfortunately, for years, the only education they were receiving were from pharmaceutical companies that were pandering their product off. And now the medical community has come back and said, we're going to educate our own and make sure they know the power that they have and how to use it. So that's the new movement. That's a great effort, and the medical community got there on their own without being forced by legislation or some other law to do it. So let's move past that. We're going to skip through this. 900% increase in 15 years. That's, Orman showed you this, 7 pills and 97 per person, 67 in 2010.
I first need to explain the MME is a morphine equivalence, a manner in which all different types of opioid pills can be measured by their opioid or morphine strength in order to compare apples to apples. This slide is a CDC and U.S. Surgeon General's opiate pocket guideline for acute pain. By the way, acute pain is broken bones, childbirth, significant cuts, etc. The highlighted black box reads, if prescribing more than 50 MME a day, consider offering naloxone, also known as Narcan, for overdose risk. Which clearly means any dosing greater than 50 ME could be a lethal dose. Why would any physician prescribe a potentially deadly morphine equivalent dose for a non-life-threatening condition for acute pain? The red arrow points out for acute pain, prescribe less than a 3-day supply, and more than 7 days will rarely be required. So let's do the math. To this national guideline, because we have a national epidemic, 40 ME equals 8 Vicodin pills, times 3 days equals 24 pills or less. We are now trained in the proper opioid dosing in less than 5 minutes. CDC guideline prescribing opioids for chronic pain states, scientific evidence is lacking for the benefits to treat chronic pain, and in general, do not prescribe opioids as a first-line treatment for chronic pain. This is a cut and paste of the Ohio Opiate Guidelines. Chronic pain is discussed in the top paragraph. To ensure the safety of patients on high daily doses of opioids for chronic pain lasting longer than 12 weeks, check the Ohio OR system. Acute pain, lower paragraph, with similar recommendations. Ohio's opiate guidelines has no threshold levels, no days supply limits, no MED limits. Allows and promotes the physician to prescribe at their discretion. This self-regulation of these voluntary guidelines have proven unsafe and very deadly to Ohio citizens. It's time for true reform with mandates that puts Ohio citizens' safety ahead of the powerful special interest associations that their campaign contributions are intended to influence legislation. The Ohio Opiate Guideline states to refer to the OR site. This is off the OR site. Providers treating chronic pain who have received opiates equal to or greater than 80 morphine equivalent for longer than 3 months should consult the Ohio Opiate Guidelines. This does not even suggest that 80 MEDs is a limit, nor does it state that 90 days is a limit. You can clearly prescribe more for longer periods and not be in any violation for overprescribing. Neither site establishes any threshold levels. With no threshold levels, there is no way to monitor and enforce physician overprescribing habits of opioids. It's left unregulated. This is the MED calculator from the OR's website. What amount of pain pills does it take to get to 80 MED? I inserted hydrocodone, also known as Vicodin, with a strength of 5/300. As you can see, I would need to take 16 Vicodins to make it to the 80 MED level. And again, this is not a limit or a maximum for Ohio physicians to follow. I then wanted to see what the manufacturer of hydrocodone Vicodin said, and this is a cut and paste off of the manufacturer's website. Dosing for the 5/300 should not exceed 8 pills a day. This is a simple pie chart showing where most opioid prescriptions are written, and 50% of the opioids are written by primary care physicians. Statistics from the OR's website. Ohio, opioid pills dispensed per patient per quarter as an average. On the left illustrates 2010. Ohio prescribed an average of 147 opioid pills per patient per quarter. Just to the right illustrates 2016. Ohio prescribed an average of 142 pills per patient per quarter. Just to the right again illustrates the CDC and the U.S. Surgeon General's opiate guideline of 24 pills maximum prescription dose for acute pain. Chart source 2016 OR's annual report. This table shows the average quantity of opioids per prescription as an average. In 2010, the average opioid prescription was 64 pills. 6 years later, 2016, the average quantity opioid per prescription was 65.
Well, we've got you all patched up. I'll give you a script for some ibuprofen, and that should help with the swelling.
Don't you think she might need something a little stronger?
You mean like this?
I don't think so. That's crazy.
Do you know that most prescription painkillers like Vicodin and Oxycontin are opiates, and they work just the same as heroin? And if not used sparingly, can lead to heroin addiction.
You know what? She's tough. We're just gonna stick to the ibuprofen.
Sounds good.
This presentation's intent is to explain that Ohio has 2 distinct epidemics that are now a public health crisis. The 2 epidemics are prescription opioids and illegal heroin. In the past decade, prescription opioid medications have killed more Ohio citizens than our heroin epidemic. I ask you for the next few minutes to separate both of these epidemics in order to rationalize what we can change.